Hello, my name is Apipol and I am the academic coordinator from the International Academic Forum. And today I am at the ACE-ID ACP Agent 2024 conference here in Tokyo, Japan. And I have with me Dr. Bhanu Ranjan from the Jain School of Global Management, Singapore. Dr. Bhanu, would you introduce yourself first, please?
Thank you so much, and thank you for giving me this opportunity. Yes, I am from Singapore, and I've been part of this institute for the past 16 years. And I've been contributing as a teacher, as a researcher, and I'm very passionate about this plot and this subject which I just presented because it is one of my students who's the main author and of course under my supervision. So yes, thank you so much. And we work in various areas of business management, and I am Assistant Dean Executive MBA Singapore. Yeah.
Right, thank you. So Dr. Bhanu Ranjan gave the presentation titled Transforming Mental Healthcare While Harnessing Artificial Intelligence. From your perspective, what is the current situation of AI in mental healthcare sector? Do you think how deep has AI penetrated into the mental healthcare section, like in terms of treating or recovering or in business sector in general? Yes.
Okay, now this particular question doesn't have a fixed answer because it's so rapidly changing every day,
Right.
every second, every minute. When we started with this topic, and since then, it's been a 7 months journey, and believe me, my data is kind of very outdated as well because it's just going on, changing so much. So that is one fundamental thing everybody has to remember. We cannot confirm. But what we can confirm is that, yes, the penetration is getting even more intense, deeper, not just from the angle of psychology, not just the angle of people who are suffering mental health, but also from the angle of how cost-effective can be. Can you imagine a country, for example, let's say, take India for that matter, or take Vietnam or any other developing country who doesn't have the sources of having a personal psychologist to address their mental health issues.
Right.
That's where AI has done a fantastic job, and that's where it has gained a lot of recognition. But US is very open to talk about it, UK. So there are many countries who are also very open to talk about it. So that is also another combination that why are we not finding the exact data. So I think we just have to keep digging in, but the penetration is definitely going really intense.
How do you think AI could contribute for us to understand or treat or cope with mental health care better?
Okay, first of all, it allows the person who's talking, the person who has mental health issue, that the data can be kept secured.
Right.
And he is not talking to someone where sometimes the mental health person has an issue of talking to another human being, but they're very comfortable talking to a machine.
Yes.
So that is a unique thing which we never thought of it before because we never had machines who could do such things, right? So that is one side of it. Another side of it as well is many psychologists can use the apps and the AI, and through the podcast or through any other way of reaching out, they can reach those people as well, far off where they can't be reached otherwise. So these two are the different angles where AI has given some great results, and AI is being taken very seriously because there are many people who are using AI as a mode of reaching out to others.
Right.
Because even the mental health person doesn't know who they are talking to.
Yes.
So whether it's a machine, it could be the machine, or it could be the human using that machine. So that is, yeah.
Let's talk about the outcome of your research, basically. So what is the business model or strategy for the entrepreneur? And maybe what is the policy implication for policymakers?
The policymakers part is slightly little concerning, and I'm nervous about it. It is about how to regulate and how to keep the data protected.
Right.
Because definitely somewhere the information is on cloud and we don't know what are the rules behind it and who's going to regulate it, okay? Like we just had a talk, the genie is already outside the bottle, okay? We just have to see how we can. Now coming back to the point of the business part of it, it is again, it's ever going, it's increasing so much. So there are some people who are having some business ideas around it. For example, the example I took in my speech, where I just did a social experiment in my house. And believe me, I was not exactly treating mental health, but I was just bringing more peace and some recognition to many people in order to avoid becoming mental health patients. So I think these are some experiments we can play around with AI. And the regulation, the policy part, I think the government and the policymakers have to come in and help people like us so that we can bring out better models and frameworks regarding AI.
From the keynote presentations, what are your key takeaways from those presentations and how they link to your study and maybe what your study can link to theirs?
Oh, that's wonderful, because I did start my speech linking what you just asked me. And I connected the keynote speakers from yesterday, from today, and also from the poster yesterday. And see, mental health can't be from one region and one discipline. It can come from any walks of life to any one of us, anytime. Okay, and we must have gone through it as well. Like I have gone through, but I have recovered in my own way. Again, the coping mechanism is important. So we just want to share through AI that don't worry about mental health. There are coping mechanisms. You should just know when do you need it, and you should just know when to reach out.
Right.
So this is something which I have a brilliant takeaway from everyone, because indirectly or directly they are talking about various expressions in the ecosystem which does impact us. Okay, so I think that is, especially the talk which just happened now, communication and the peace. I think that also brings out a lot of perspective of mental health. Just because we are not suffering right now doesn't mean that it's not in our mind and it is not knocking at a door and sometimes doesn't give you sleepless nights.
Right.
It does. So that's my take on it.
What do you think should be the future discussion within your field? What do you want to see more being discussed, like academically?
I really want, nothing under the sun should be left without being talked. Because the concerns are definitely nerving, because I really don't know after 5 years or 10 years, would I be relevant? Would I be there?
Right.
But like tomorrow, my talk is about future job, and I'm really very pessimistic about it. But that doesn't mean I do not share with the people that I am pessimistic about it. I am concerned about it. But for me, it's okay. I can still say I'm retiring and I can go back. But can you think of someone who's younger than me? What would they do? They can't even retire at this time. So for them, we have to tell them, first of all, we hear you. We understand your fears, and now let's sit down and see how we can cope it up, rather than it just comes as a surprise and then it not just disturbs your mental health, it also gives you a heart attack. So we don't want that. Thank you.
Thank you. And last but not least, a message for our future conference attendees.
I think this was a wonderful conference, and I could hear diverse people coming in, especially the young PhD scholars. I really like that. And these youngsters would be hand-holded by us, and through our presentation, what next to be done. For example, I was very clear in my presentation, giving them that these are the lackings, these are the shortcomings, and these are limitations in my presentation. Please take off from here and research further, so that the whole chain of research continues, and we need to spark them and ignite them in the right direction. So I think let's keep that going, and we should keep discussing more sensitive topics to the most popular topics as well. Yeah, thank you.
Thank you very much.